All right, class, today we are going to talk about maxillary injections and the techniques for that. Okay, so first the course learning objectives. Who would like to read that?
I will.
Okay.
Describe proper technique when administering local anesthetics.
Okay, next one.
Describe proper technique for nitrous oxide sedation.
Perfect. Again. The next one.
Accurately explain injections with proper landmarks.
And the last one, understand proper infection control during injections. All right, next is the class session objectives.
Create injection guide to be utilized in pain management lab and clinical courses.
Okay.
Describe knowledge of proper technique for each injection. And describe knowledge of proper protocol for nitrous oxide.
Perfect. All right, so we'll go ahead and get started. So this is our armamentarium, basically all of the things that we need when we do an injection. So I'll go ahead and start. First, we need our syringe. Next, we need a short or a long needle, depending on the injection. Most of the maxillary injections are short needles, though. Next, we need the local anesthetic cartridge. We'll need cotton tip applicator for the topical anesthetic, which is down here. Then you need 2x2 gauze, usually about 3 or 4. Your PPE, so your gown, mask, glasses, and gloves, so your protection. You need your cotton pliers in the case of a needle breaking. You can take it out with the pliers, not your hands. Saliva ejector, and then your air water tip for the very end. So first injection is the ASA, which is the anterior superior alveolar. So the areas anesthetized for this injection are going to be the pulp, the buccal bone, periodontium of the central incisor, lateral incisor, and your canines. So that is going to be these front teeth up here. So your central, your lateral, and your canine. First thing we need to do is find the penetration site. So that's the height of the mucobuccal fold. So you're going to take the patient's lip, pull it super taut so you can find the mucobuccal fold, basically where the gum line meets with your lip and the top of the gum. And that's going to be anterior to your canine eminence, so it's going to be about right here, right in front of the anterior canine. Path that's parallel to the long axis, so just like this, right on the tooth. You're going to go in about 1/4 of an inch with that 27 gauge short needle. You're going to deposit 1/3 to 1/2 of a cartridge, depending, but in lab, we do the lowest possible dose, so 1/3 cartridge. And then our landmarks, again, are the height of the mucobuccal fold, anterior to your canine eminence. Any questions with the ASA? No? Okay, we'll go to the next one. So next will be the MSA, middle superior alveolar. Again, air is anesthetized similar to the ASA, pulp, buccal bone, periodontium of the maxillary premolars, and the mesial buccal root of the first molar. So it's going to be your 2 premolars back here, and then this front half of the first molar. So penetration site, very similar, height of the mucobuccal folds. Again, at the apex of the second premolar for this one, so we're going to go to the second tooth right here. Depth, same, you're going in 1/4 of an inch with that 27 short needle. Again, you're going in about 1/4 of an inch. The terminal deposition site, it's just above the apex of that second premolar, so right at the top of the root of the second tooth right here. You're going to deposit 1/4 or 1/2 to 2/3, and landmarks are again height of the mucobuccal fold and the apex of that premolar. We have extra students in class today. Any questions with the MSA? No? Okay. PSA, does someone want to read the air is anesthetized for this one, that top line?
The pulp, buccal bone, periodontium of max second and 3rd molar, and DVL root of 1st molar.
Okay, so DVL is distal buccal lingual root. So that MSA got the first half of that one. This one we get the last half and the tongue side. So penetration site, again, height of the mucobuccal fold, distal to the maxillary second molar, so it's going to be way back here for this one. This one, the path is different for the injection versus all the other ones. So you're going to go inward, upward, and backward at a 45-degree angle. So basically, you take your syringe and you just go whoop, just like that. If you make that noise, it kind of helps you get in the right spot. So depth is 1/2 to 1/4 of it, or 3/4 of an inch. Short needle again. And then, so our terminal deposition site is the foramina of the PSA nerve. typical to the, okay, class, behave. Class, behave. Okay. Apical to the second molar roots. And then for this one, we are depositing half to a full cartridge because we got to get a lot numb back there. And then our landmarks are going to be our mucobuccal fold, our maxillary tuberosity, our zygomatic process, and our occlusal and mid-sagittal planes. So for our landmarks, for the ones that get a little bit more complicated, I like to list them off on my hand so I know how many I have to know. So for this one, I need to know 5 landmarks. Okay, are you gonna behave? Any questions with this one? Anyone? No? Okay, perfect. So next is our nasopalatine. For this one, the areas anesthetized is the lingual mucosa and the osseous tissue of the maxillary canine to canine. So for this one, this is when we are going to do it right back here into this incisive papilla. It's a little painful, this one. So penetration site, again, palatal mucosa, lateral to the base of the incisive papilla. So you're gonna take like a cotton tip applicator, find it, locate it, and then you're gonna go straight up 45-degree angle for your path of insertion. Again, with this one, you don't need to go super far in. It's about 2 to 3 millimeters with the 27 gauge short needle. And then the terminal deposition site, so where you're going to inject, it's 2 to 3 millimeters from that penetration site toward your incisive papilla. So this part right here, if you can feel it with your tongue on your mouth, it's that little like bump of tissue there, that's where it's gonna go in. This one we don't need a lot at all. It's about 1/4 of a cartridge, but a good way to gauge it too on your patient, it'll start to blanch when there's enough local anesthetic in that spot. So it'll kind of start getting white in that papilla. So that's how you'll know. And then landmarks for this one, super easy, incisive foramen, papilla, and the central incisor, so those front teeth. All right.
That will get all 4 of the front teeth?
Yes. Yep, so it'll get these ones, well, it'll actually get 6 to your canine. So it'll get your 2 front teeth, ones next to it, and those pointy canines. Next is going to be your greater palatine. So this is gonna get that hard portion of your palate on the back. So areas anesthetized are going to be your lingual mucosa, osseous tissue of the posterior portion of your hard palate. So if you like to look, it's just way back here on that hard palate. And then the soft tissue. So for this one, penetration site, again, 2 to 3 millimeters anterior to the greater palatine foramen. So this one you can locate your depression with the swab. So you can just kind of run it along their hard palate. Once you kind of feel a softer spot, that's when you know you're in the right spot. So for this one, you're going to do 30-second pressure anesthesia prior and during your injection, so it's less painful for your patient. So you're gonna take your cotton swab, locate your depression, push down for 30 seconds. When you do your injection, same thing. Again, with this one, it'll blanch, so you know how much you're supposed to be putting in, but you're doing about 1/4 of a third to the cartridge, so again, not a lot. And when you go in, you're going in less than 10 millimeters with your 27 gauge short needle, so not too far in. And then your landmarks, greater palatine foramen, junction of your maxillary alveolar process, and the palatine bone of your second maxillary molar. Questions with this one?
Why do you use a long needle?
That's usually for the mandibular injection, so that'll be next week's topic.
Okay.
So all maxillary injections are the short needle, so it's pretty easy to remember when you're doing the top. Any other questions? Okay, perfect. So next we're going to talk about nitrous oxide. So this is the fun stuff. A lot of people like to use this. So the first thing you need to do is determine the need. So if your patient's super anxious, doesn't like the dentist, when you're probing, so doing those measurements, if they kind of jump a little bit, that's kind of a key to tell you that, hey, they might need nitrous oxide. So first thing after that, you need to determine their tidal volume when you put the oxygen on them first. So basically in the beginning, you take your vitals, you just take their respiration. So say it's 16, you take half of that. So their tidal volume is 8. So you put it up to 8. So once all of that's set up and you have your patient in the chair, you put them on pure oxygen for 2 minutes with that nasal hood, just so they get used to the flow of everything, make sure everything fits properly in their mouth or on their nose. And then you're going to titrate, so with the nitrous and the oxygen, the first minute you just do 1 liter, so your nitrous goes up, your oxygen goes down. Then the next minute after, it goes down half, up half, until they hit their therapeutic level. And they will let you know that they're at that level once their body starts to feel kind of tingly and numb. They're gonna kind of hear audible sounds, so it's gonna feel they're gonna feel kind of like after you've had like a drink or two of wine. That's kind of how you should feel. So yeah. So at the very end of your nitrous oxide sedation, you are going to put your patient on pure oxygen for 7 minutes just to make sure that they're back to normal. After that, if they feel fine and normal, they can drive themselves home. It's not one of those where you have to like have a driver with you. So you can do that. And at the very end, it's super important that you take your post-op vitals because you want everything to be within the same range as what it was when it began. So their blood pressure and their pulse usually is within 10 of what it was in the beginning. Respirations need to be within 5. So if they were at 16, it has to be within 5 of that. Questions on nitrous?
No.
All right, perfect. So next we are going to work on our maxillary injection worksheet that I have. So we're just going to go through a list of all of our things that we learned today and make sure that we know all the proper stuff. And then we are going to create a injection guide to use in lab and in clinic. So this will help you know the proper landmarks, make sure you're putting enough anesthetic into the patient for the injection. Yeah, any questions?
No.
No? Okay.
I think so.
Go ahead and start working on your worksheets. Okay, so we've worked on that for about 15 minutes now, so that's great. Next thing for the rest of class, you can work on your injection guide. You can pull out your computers and start it on a Word document if you would like. You can make an Excel spreadsheet if that works better for you just to get the table going. And then after that, we'll go over it and then we will go ahead and watch the maxillary injections video that we have. We'll be done. Okay,
All right.
go ahead, get to work. You can stop it now.